Okay, so I'll get started. First, I'd like to acknowledge the traditional owners of the land on which we are meeting, and I pay my respects to the elders past and present and the Aboriginal elders of other communities who may be here today. Good afternoon, everyone. Thank you for joining this month's webinar titled Climate and Air Risks and Solutions. I'm Sabrina Idros, a Centre for Safe Air Postdoctoral Research Fellow, and I'll be chairing today's webinar. Australia's first national climate risk assessment revealed that poor air quality, especially from bushfires and extreme heat events, is a growing threat to public health. Hospitalizations and premature deaths due to bushfire-related air pollution are projected to rise with higher rates of respiratory and cardiovascular diseases, especially in vulnerable populations. Simultaneously, many interventions that reduce climate emissions have significant co-benefits for health through cleaner air. In this webinar, we explore both the modeling of climate change-related air quality risks and how researchers are evaluating the health benefits of policies and interventions to reduce emissions. It will feature presentations from Dr. Justin Boyle and Dr. Hannah Morris. Each speaker will present for up to 20 minutes, followed by a Q&A after all presentations have ended. So please drop your questions in the Q&A section. Our first speaker is Dr. Justin Boyle, who is a research scientist in the Health Intelligence Team of CSIRO's Health and Biosecurity Research Unit. Justin has an engineering background and is passionate about the application of analytics to reducing the severity of disease or disability. He is particularly interested in the analysis, visualization, and interpretation of data to derive new insights and knowledge that can help shape policy. Justin was one of the authors of the Air Quality and Communicable Diseases Technical Report and led the component addressing bushfires and climate change. Over to you, Justin.
Good morning. Hello, everyone. As Sabrina introduced me, Justin Boyle, so I'm based at the Royal Brisbane and Women's Hospital, so in Meanjin. So I'd like to first acknowledge the traditional custodians of the lands from where we're all joining from. In Meanjin, it's the Turrbal and Yagara people, so I pay my respects to their elders past and present and extend that respect to all First Nations people that might be joining this webinar. So yes, I'm going to talk about the health impacts of severe bushfires under climate change. As a bit of background, it's really unequivocal that really no doubt that the planet is getting warmer. So last year in particular was the hottest on record since records began. In our own region, Australia's climate has increased by 1.51 degrees since the national records began, and we're seeing record highs, surface temperature like this plot shows, but also greenhouse gas concentrations. And so with this warming climate, we see that we have more heat waves and droughts, and these heat waves and droughts may dry out the vegetation and can increase the probability of bushfires. And bushfires have been around; they're an ancient feature of the Earth. But really we're seeing fire weather, which is really hot, dry and hot conditions becoming more common and more severe, and the length of these fire seasons increasing. And the projections show that really it's going to probably maybe increase 20 to 50% of the days that are conducive to bushfires, and probably the sharpest areas in subtropical southern hemisphere regions. And in terms of health impacts, we've got exposure, direct exposure, things like burns. There's also impacts on the environment and ecosystems. Imagine things like farming and the reduced yields that farmers might experience. But this talk is going to be focused on health impacts from emissions, so namely smoke, which is made up of particulate matter, a lot of carbon. So we have this acronym PM, short for particulate matter, and 90% is in the size range of the particles are 2.5 micrometers or microns. So PM 2.5 is the majority of this particulate matter in smoke, but there's also gaseous pollutants, including nitrogen dioxides, ammonia, sulfur dioxide, methane, and carbon dioxide. And there's very good, strong evidence in the literature that health impacts really are dependent on people's age. So there's a lot of vulnerable people are more susceptible to experience the health impacts. So this is older people, Indigenous Australians, people from lower socioeconomic areas. And the impacts that are clear in the literature are increased emergency department presentations, hospital admissions, outpatient GP visits and deaths and medications. And really the main upshot is that controlling this fine particle pollution would result in fewer deaths and hospitalisations. In terms of the impacts on the body, it's very clear evidence about the respiratory system impacts. It's a little bit mixed, the evidence in terms of cardiovascular system impacts, distinct from bushfire smoke is distinct from all air pollution, but there's still a lot of studies that report these adverse outcomes. Also for mental health, these are reported in the literature from exposure to bushfire smoke, and these terms coloured in green and some new terms appearing in the literature to describe the loss that people feel from losing their home, particularly Indigenous Australians, from environmental disasters. There are some gaps though, long-term health impacts, which including firefighters, so it's not really an acute thing before shift and after shift, but really over a season, before the season compared to after the season. And firefighters do show some recovery of their lung function after the season, but many cycles of this is unknown, that the effects of that. Most evidence is for this PM 2.5, but other pollutants are not as well understood. And also when you've got combined pollutants together, long-term conditions, exposure, people that do have lung damage, exposure to bush smoke is not as well characterised, also for children. And then also what's going to happen in the future. And for example, in the middle of this century, and this specific question was put to us last year by the Australian Climate Service as part of the National Climate Risk Assessment, saying what's going to happen with our health if we have a severe bushfire in the middle of this century. So this National Climate Risk Assessment, it's a partnership between CSIRO and Geoscience Australia, Bureau of Meteorology and the Bureau of Statistics. And the upshot is that in the future, because of all this extreme heat and floods, there will be higher risks to health. So there's been a little risk assessment done, and of the areas or domains that this has been ranked, there are two that actually, so they've got little current where we are now and where we're going to be in 2050, and two of these are ranked very high, so particularly health. So there's a lot of evidence in this National Climate Risk Assessment about those health impacts. CSIRO did a few of these technical reports informing this risk assessment, and what I'm presenting today is from one of these related to air quality and communicable diseases. And that the whole summary of this work, the main point is that there's really a strong need to get urgent adaptations that to combat this and protect ourselves against this risk, especially those that are socially disadvantaged. But in this specific question too, we asked two specific questions in this activity for the National Climate Risk Assessment. They're shown in blue. The first one was about the impact for bushfires in 2050. And the second one is about increased transmission of communicable diseases. And I'm not going to talk, apart from this slide, about that communicable diseases, but it's very, really interesting in terms of if we've got an increased temperature or climate, what's happening with a number of these diseases. And so we're projecting increased rates of influenza and methicillin-resistant Staphylococcus aureus, which is a bloodstream infection of concern. We also looked at spillover risk. That means diseases moving from an animal or from one species to another. And there's mainly zoonotic spillover, which is because 70% of emerging infectious diseases come from animals. And in fact, all the pandemics in the last 50 years have come from animals. So when we talk about orders of animals, these mean things like rodent family and the primate family, and seeing the likelihood of these changing with that warming temperature. And then finally looking at genetic mutations and some really exciting evidence that's generated saying that we can see changes in the genes for particularly H1N1 influenza and also Salmonella and Japanese encephalitis. So that's exciting. But the main focus here was just about bushfires that I will talk about. And the challenge is that we don't have a model that can predict what smoke will be like in 2050. So we based it on the most severe bushfire event in Australia to date, which is in the summer of 2019 and 2020. And that smoke comes from a system in CSIRO called the Air Quality Forecasting System. And then we compared that to also projections of climate. That comes from the National Environment Science Program modelling runs to say what's the difference in climate between now and the future. And so we compare the present time, which has got this bushfire component, and then also the future time, which has got the difference between now and the future. So in terms of how we measure that climate change, we're looking at 4 global climate models, and there's about 50 of these potential global climate models, but chosen 4 of these and using a chemical transport model that CSIRO has developed to look at how changes in meteorological variables then affect pollutants in the atmosphere. And these 4 particular models that just chose different scenarios in terms of what a future might be. And then we've got there's a number of different socioeconomic pathways, and we've chosen 2 that are arrowed here, one based on a worst case where there's still maybe phasing out of diesel, but still, a best case and a worst case are arrowed. So the best case is with renewables, and the worst case is still with fossil fuels. So we've got 4 global climate models and 2 socioeconomic pathways, so 8 models in total. And all these models have bias in them, but we can't compare across the models, but we can compare within a model. We say from one model, what's happening in the future compared to now, and we get a difference between that. And we use a 5-year range just because 1 year may not be representative, and just get what's that difference between that future and current time period. That's for climate change. And so these models then, here are our 8 models for a number of meteorological variables, between where we're predicting some areas of Australia predicted to increase up to 8 degrees hotter, and wind and cloud and rain. But you can see that none of these models, there's differences between them, which is why it's important not to rely just on one model, but use an ensemble of models, because sometimes they don't even agree on the sign change in terms of is it going to increase or decrease. But from these changes in meteorological variables, then we can say, well, what's the changes in airborne pollutants, in this case PM10, so particulate matter with a particle size of 10 microns, where the shading, if it's white, it's not much change between now and 50, and dark and color. And we can see places, particularly in Central Australia, with predicted to have more higher rates of particulate matter, and which is largely dust. And PM2.5, which is by definition is included in PM10, just it's a smaller particle size that does get further into the airways. The changes there, and then also ozone and nitrogen oxide. So these were nitrogen dioxide. These were our pollutants that were modelled in terms of the climate change aspect. For the bushfire component, that comes from this air quality system modelling, which it's used operationally at the Bureau of Meteorology for looking at predicting smoke from prescribed burns and bushfires, but it's got a top-down approach looking at from satellite imagery to say, looking at that, and then bottom up from actual audits of where things that are burnt, and then predicting what's tomorrow's area that's going to be burnt. And then also the smoke is also modelled, the combustion and smouldering of that smoke. So that is how we then get the information for the air quality from a severe bushfire. And we've chosen a period that included the most severe bushfire to date. It's unprecedented. So this is called the Black Summer bushfires from the end of 19 and 2020, beginning of 2020, sorry, which was affected, cities of 11,000 kilometres away. This little plot here shows an average from all the hourly observations, but across that 1st of January in 2020, and particularly the little enlarged bit which shows ACT, where I think on that 1st of January, residents were exposed to levels of PM2.5 that were over 30 times the limit just on that day. And those effects persisted for a week at that time. And we can see also Central Australia has that large also particulate matter, which is from dust, and we can't remove that from our environment. Our future environment will also have dust. We can't remove dust from environment. So we've got this information from the about the smoke, and that comes out as a surfaces model. And so here we relate the air quality to the impacts on health using what's known, these little functions, mathematical functions, they're called health impact functions, used by a lot of environmental agencies to quantify the impacts of air quality and worsening air pollution. And they include an effect estimate from epidemiological studies. That's often like the risk of exposure to this risk is that, and that's often derived from a study, the baseline incidence, and then a population, which also in the future we have to project out to 2050. And we're looking at the change in air quality using our pollutants from this air quality model and also the National Environment Science, the climate change component. And that's put as a surfaces model, meaning so it's not, we're not using air quality monitoring stations, which a lot of some other previous work has used, but which are limited here. We've got a little map of where those air quality monitoring stations are. We can see they're mainly at the population centres and northern Tasmania hotspots. But it's a surfaces model that covers, that serves at 20 by 20 kilometre grids. And then we have our bushfire amount, which then we sense check against published estimates just to say, look, are we on the right track? And then look at that in comparison with that climate change, which is looking over the December, January months, what's the difference between a future time and a current time? And so just how that works, the quality comes out a little bit low here, but we've got our raw data on the left, which is across Australia in these 20 by 20 kilometre grids, arrays, and we convert that into statistical regions, so geographic regions, so SA2 here, these regions, and this is showing particulate matter in micrograms per cubic metre, so the density of this based on our raw data, and then we apply this health function for every day to look at the impacts from these pollutant levels. And so when we look at outcomes, the health impacts have been, the severity of these have been described as this pyramid. So at the top, we've got the worst outcomes of deaths and hospital admissions and ED presentations. But the highest proportion of people are probably those that actually don't go to any, that seek care at the bottom of that pyramid. But here we've focused on that pointy end of the pyramid in which other studies have also tend to focus on, and it's, you know, we can't get a worse outcome than death. So here are our outcomes, and then we use these relative risks that have come from the literature. The first couple are from WHO and also a local systematic review on asthma ED presentations. And we can see that basically they've come, as your air quality worsens, meaning more particulate matter in the air, the risk of these outcomes increases. And risk, if we talk in terms of the risk between exposed population and unexposed, so it's this fraction, and so they're not very high. You can see this, you know, they're just over 1, but as you'll see, it does make a small impact. And the impact, so if we've got a risk of 1.0123 relative risk, that means for every increase of 10 micrograms per cubic metre of this pollutant level, the risk between those two groups increases by 1.2%. And because we use a log linear concentration response function, it means we just can say, well, if we want to, you know, what would it, for a 10% increase in deaths, the pollutant level will have to go up by 78 microgram per cubic metre. And seeing some of those plots from like the 1st of January in 2020, you can see how, yes, there would be times when that pollutant level goes up. So these risks, we've done a main analysis with it, but then there's other sources. So we've done a sensitivity analysis with other coefficients just to look at the impact, and also other pollutants, ozone and nitrogen dioxide. And so the first part is just to compare, if we're using these relative risks and computing from our bushfire smoke model, that from our present air quality model, what are these impacts? And we can see they all have prediction intervals. So we have a predicted impact and then an uncertainty, which is expressed as 95% prediction intervals. And when compared to another study looking at this exact same event in Australia, the estimates are slightly smaller, but still within the prediction interval of this other study. So we can say, yes, it's of the same order of magnitude, which is enough to say, well, let's use this then to say, well, let's compare. And the differences are because one was based on air quality monitoring stations, and we've used a surfaces approach. But then if we look at, here's our bushfire impacts, and then if we've got a worst case future, because the models don't agree, we've looked at a worst case model and a best case future model, and how much the air quality, the health impacts from that climate change would worsen. And you can see this ratio, it's less than the time of the severe bushfires, but at the worst case, it's probably 1:4 ratio, meaning about a quarter of the impact. So climate change impacts would be about a quarter of that of a severe bushfire. In the best case, it would be about an eighth of those impacts. So that's the main analysis, the sensitivity analysis with different coefficients here, these relative risks, different impacts, but the ratios are pretty much identical. And that's for PM 2.5, and for our gaseous pollutants, the ratios are a little bit higher, but still quantifying these impacts. And we don't add these impacts together because there would be sort of potential for overcounting from these pollutants, and that remains an area for future research. That how do you account for multiple pollutants in the one model to account that, because these health impacts they're not independent. You can't say, oh, this is the impacts from particulate matter and this is the ones from methane. Just to complement that, we did also look at some data that was from Australian data, and because temperature is a confounder in this, looking at adding temperature, and we thought, well, let's try to look at Australian derived relative risks, and this is some data we were grateful to receive from the CARDAC group, Curtin University and Centre for Safe Air, and then modelling that with AIHW, this Australian Research Data Commons bushfire data set, which is a fantastic resource over 20 years, but it's at quite a coarse level, SA4 level of data. And that's really interesting, just basically comparing firstly, the smoke model that we used before for bushfires compared to this CARDAC model. So this is a machine learning approach for daily bushfires, and just looking at the particulate matter in the middle, and then the derived health impacts. And this, I know the scale can't be read, but it's blurry, but they're the same. The scale is the same in each, so you can sort of see there are slight differences, but generally the same. And this modelling, we found that here, this is really interesting, that this is ED presentations for respiratory conditions in Australia and cardiovascular conditions. The size of the dot is related to the particulate level. And so the end of 19 and 20, we can see some big dots here, particularly in the ACT. But really the higher thing that drives these health impacts are more temperature and seasonality. And if we try to then look at what are these risks for a number of these outcomes, we can then derive sort of local relative risks, and these compare well against published estimates. So, for example, for respiratory admissions, that relative risk was 1.014, and so the WHO one that we used in our main analysis, it compares quite well. For cardiovascular admissions, so it's 1.0137, so a little bit higher than the one that was used in our study, but again within the prediction intervals. I did want to just mention clearly that putting these in context, we know air pollution is the leading contributor of global burden of disease. This is measured in disability-adjusted life years, but in Australia, air pollution, and it's not bushfire smoke only, it's air pollution is still up there, not as high as everything, but still quite a significant contributor to deaths. But if we looked at that most severe event, bushfire event to date, and this is the published estimates from others that did quantify these impacts, if we look at what else was happening in the hospital systems at that time around the country to say, well, what is that number compared to the national volume, it's less than 1% in cases, except ED presentations about 4%. So while that's substantial, it's still there's a lot of other activities we would like to see. Obviously there's controls to bring in. I think maybe Hannah might talk next about that. But finally, I will just wrap up by saying we expect that climate change will adversely affect health, and it'll be about, we estimate maybe as worse as much as a quarter of the effect of severe bushfire smoke. And that comment that we made before about there are high levels of particulate matter in Central Australia that a lot of Indigenous populations experience all the time, which will be in our future climate. The next steps for this, we're extending this to thermal comfort, and so we've just built an app to say, well, using some of the Bureau's measures for measuring thermal comfort. So this is something called excess heat factor and wet bulb temperature, which combines humidity and temperature to say, well, given these conditions and for a given region and a month, what is the impacted heat from that? That's one little area. I'll just give a little mention this National Climate Risk Assessment. The Australian Climate Service are doing a few more webinars, specifically about this one tomorrow, which I think on their website you could probably register in coming weeks. And so I've got a lot of groups to thank, but might leave it there. Thank you very much.
Thank you so much, Justin, for providing an excellent overview of the predicted health impacts of bushfire smoke by 2050. There's a question in the chat, but we'll get to it after Hannah's presentation. Our next speaker is Dr. Hannah Morris, who is a research fellow in the Disaster Climate and Adversity Unit at the Melbourne School of Population and Global Health, the University of Melbourne. Her research focuses on the translation of evidence into policy and practice, with a particular interest in the intersections of climate, health, disasters, and community adversity. She works as a boundary spanner between research and policy, building collaborations that strengthen the real-world impact of academic work. Hannah co-leads the Idle Off project with Dr. Claire Walter, Rebecca Patrick, and Belle Workman, which partners with local governments and schools to reduce children's exposure to vehicle emissions through community-driven anti-idling campaigns. Over to you, Hannah.
Thank you so much, and thanks, Justin. That was really interesting and a really good precursor to, I guess, I'm looking at a different part of research.
We can see a presenter's view, so I think you need to swap the display.
Oh, sure. Haha, we predicted that would happen.
Okay, yeah, that looks
Okay,
good.
great. Perfect. Okay. Well, thank you so much for having me here today. I'll just correct, I'm not a doctor. I did a Master's of Environmental Law instead because I was really interested in how research translates into legislation and policy change. So chose to go down that route. But and I also want to begin to firstly acknowledge that I'm zooming in today from the lands of the Wurundjeri, Woiwurrung and Bunurong people of the Kulin Nation here in Naarm in Victoria, and also acknowledge sovereignty has never been ceded. So I belong to quite a few different public health, cross collaboration groups here at the university, but really the main one that I'll be speaking about today is the Catch Lab, the Climate Catch Lab. And what we're interested in is how to create research that has the impact of climate resilient, sustainable, and equitable communities and health systems. And really what that means is that we just collaborate with lots of different people from different areas across the university. So this project really started out because a colleague who sits in our mitigation stream of the Catch Lab was interested to understand how her PhD research, so Dr. Claire Walter, her PhD research could potentially have some sort of real world application and real world policy change. And so we got together as a team to kind of think through how we could get some of this research out there into the real world a little bit more than it currently is. So I just wanted to start by acknowledging this it's not just myself, it's really being led by Dr. Claire Walter, as well as Rebecca Patrick and Annabelle Workman here at the university. And then we've got partners from Royal Melbourne Hospital, Doctors for the Environment and Deakin University, as well as Climate and Health Alliance. So today I'm just going to quickly go through a really quick what the evidence base says. I'm going to talk a little bit about the international case studies that exist and then how we're applying that here in Australia, and then talk about what needs to happen in the future. So as we know, there's a lot of different sources of air pollution, and we just heard then from Justin a really excellent example of how bushfires create air pollution to then have an impact on human health. This project looks at the impact of vehicle emissions, or what's known in the literature as traffic-related air pollution. So if you see the term TRAP, that's what that means. And sorry, I'm just going to change. I can't see my notes with the current. There we go. And so this is just a pretty rudimentary kind of example of how those traffic-related air pollution has an impact on human health in all the different ways. And something that's important to note is that children are the most vulnerable to the impacts of air pollution. That's because traffic exhaust particles are small and toxic, and so when they're inhaled, they penetrate the bloodstream, impacting every single organ in the body. And so, because of the smaller rate of children under the age of 5, in particular between 0 and 5, the impact of traffic-related air pollution is its worst. And so we thought, this is it's important to design an intervention that really impacts young children. And this is also the context in Australia. So asthma is the leading burden of disease in Australian children, and traffic emissions are now considered a causative factor in the literature. We also have international evidence that suggests that 1/3 of asthma cases are attributable to air pollution. The evidence base is pretty clear now. There's lots and lots of evidence both in Australia and internationally that links in a causative way the impact of traffic-related air pollution to respiratory health. And so what I'm talking to you today is not really about what the evidence is saying, and our research team certainly has people in the team that look at that in more detail, but my role is not really that. My role is now to use, to know that we've got this evidence here, and to try and translate that into some sort of social action to help reduce those impacts. What we also found is that there's the literature is showing that there are hot spots of air pollution at school drop-off and pickup. And actually, the policy currently is, it changes, locally and statewide, but in many cases, the policy is that parents are encouraged to idle at school drop-off and pickup because they have like a 1-minute parking zone, and so they're encouraged to keep their engines on. And what we were able to notice was that there was this increase of traffic-related air pollution at certain times at schools. So Cheng did a study in 2022 that demonstrated a transient exposure to nitrogen dioxide associated with a 38% increase in emergency department presentations for asthma, occurring only hours after exposure. And I guess something that Justin touched on then, the thing with air pollution and its impact to human health is that you only need to have a very short exposure time to receive the majority impact to human health. So it doesn't matter that you might be exposed to it for 10 minutes, for example, as opposed to 10 hours. It's going to have a negative impact at quite a high level within those first 10 minutes. So short-term exposure is associated with increased risk for acute upper and lower respiratory tract infections, and that school exposure was shown to increase systemic inflammation. So this kind of translates into a really interesting fact that I don't think many of Australians understand, but leaving your engine running has the same impact as smoking a cigarette next to a child. And so why do we allow this? And this is kind of where our project started working. There's a real disconnect between policy objectives and policy outcomes here in Australia. And there's kind of three things happening at the moment. There's a low awareness of the risk of air pollution on human health and certainly traffic-related air pollution. We're convinced that the majority of Australian parents are not potentially aware that their sitting in an idle vehicle has the same impact as, say, smoking a cigarette next to their child. There's also structural barriers and also political barriers. And what we mean by this is kind of multifaceted. There's the structural barriers in terms of access to being able to change some of these policies. The fact as well that we live in a federated state, and I'll go into this a little bit more detail coming up. But we've got local government, state government, and then federal government. And then across that, we've got different interest groups that all have vested interests in some of these issues. But relative to an understanding of sugar in soft drinks or the effects of cholesterol on older people and heart disease, I think the average person would be totally unaware of the effects of vehicle emissions on human health, particularly on children. And most people would believe Australia has clean air. So that's a quote there. And that's really where I think we are currently as a country in terms of this issue. And that's what we're really keen to try to change as stakeholders in this group. So we focused on designing an intervention that really looks at how to raise awareness on this issue. And the reason we did that is because it gives a solution. And we know that when you speak to decision makers, they're really not just interested in hearing from you about what the problem is. What they want to know is what your solution is and whether or not that solution works. And this particular anti-idling intervention is associated with demonstrable change. It's low cost and it's also equitable. And it has co-benefits for health, climate, and the economy. So it makes sense kind of in those three different domains. And finally, it creates a social license for broader behavioural change and future policy reform. So it's sort of like a seed to start people thinking about how their behaviour contributes to air pollution, and then that then contributes to health. And for us to then kind of start that link in their brains to then have a higher level of understanding in terms of things like climate change, air pollution, and health. We do already have some actionable case studies that are happening across the globe. So in the UK, there was the Engine Off Every Stop or Idling Action London campaign, and they had some fabulous advertisements that go along with that. We also had the Billy Never Idles and Neither Should You campaign happening in New York. And then again, it has an effect where there were actually some anti-idling laws to fine you or to make it illegal for you to idle in certain zones. And there's other places around the world, in Tokyo and Denmark and Finland, for example, where they've introduced some sort of anti-idling or legislation or campaign. So the argument that we are using is, why haven't we done this here in Australia when we have some of the highest rates of vehicle use and urban environment? So in Australia, the policy context currently is a bit mixed. As I said, we've got local, state, and federal government all making decisions about this area. And what we've found in the past 12 months of doing quite some intensive engagement on this space with decision makers is that it really cuts across lots of different departments. So it sits within the Department of Health, the Department of Education, Environment, Transport Planning, etc. And because of that, it's very hard to understand who takes the lead. So when you're trying to pitch for a campaign or a policy change, it's helpful to be able to pitch that to just one ministry or one department. But instead, this particular issue kind of sits across all. And so you do need a bit of a whole of government approach in terms of implementing a solution for it. And that makes it a little bit tricky. What we have found, though, is that at the local level, there's quite a lot of interest in this. And we have, for example, here in Victoria, the Maribyrnong Council have a particularly high rate of air pollution in their council area. I think they've got something like 9 times the national average for pediatric emissions for respiratory conditions here in Maribyrnong for children. And so they're really keen to do some things on this issue. And you can see in their air quality improvement plan, they actually have an action here that says implement the Maribyrnong Integrated Transport Strategy Vehicle Anti-Idling Program to discourage vehicle idling outside schools, railway stations, railway crossings, and shopping centres and hospitals. So that's the beginnings of, how a policy lever, I suppose, for us to try and say, oh, this is great. You've got, it's actually in your improvement plan. It's one of your actions. How can we help kind of get this off the ground a little bit more? Finally, we also have in our National Health and Climate Strategy, which is a federal level policy instrument, one of their main objectives, which is Objective 4, is to adopt a health in our policies approach, which means supporting healthy, climate resilient, and sustainable communities through whole of government action. And just as I just said, this kind of anti-idling policy, idea really requires a whole of government approach. So, one of the things we're trying to argue is that this is a great sort of example for how we could potentially start working in this health in all policies way. What I would say as somebody who's had an interest in this area for a long time and been watching it, aside from in South Australia, the state government there, Australia currently doesn't work in a way that I would say is this health in all policies approach. So the government is really looking for ways to try and adopt this, and how could you essentially do this in reality? So that's sort of something that we're really keen to promote. And finally, we've got some case study examples of where the lovely Doctors for the Environment, this is Fiona and Anthony, have actually taken it up in their kids' own school, and their local member is Allegra Spender. She's a Teal MP, and you can see here that they actually got their school on board and created their own campaign here. And I'll just check the time to see. I probably don't have time to play this video, so we have some time for questions, but I can share it following if people want, because I do have permission to share it. Finally, we've partnered with, as I said in the beginning, Deakin University, and so they had a Breathe Melbourne study that they ran where they actually piloted an anti-idling intervention at schools in the inner west, in the Maribyrnong Council areas. And their results have recently been published. Again, something I can share following this. And what it did show is that it did actually reduce idling from 60% to 42% following the intervention. And it was a really beautiful little study where children were involved with co-designing the kind of messages and the actions, and then they would educate their parents on the impact of idling near schools, and then encourage their parents to turn the engine off when they were near schools. So that's kind of where we were at in Australia, and you can see there's like beginnings of people wanting to do something about that. But I guess our question was, how can we scale this up and actually make it a big campaign? We built a team with DEA, Climate and Health Alliance, Deakin University, and also a marketing agency who do lots of social purpose or social good marketing campaigns. They've worked for Climate Council, etc. in the past. And what we wanted to do was multi-pronged. We wanted to design a policy brief so it was easy for us to take it to government and explain why this needs to be a priority for them. We put together a project plan and, of course, an evaluation framework. And then we designed some campaign artwork. What's happening a lot in research these days is to understand that you can't really design interventions that need to sit in society and with community without the community consulting on it first. And so we did some co-design workshops with different stakeholders across Australia, with the big players like Lung Foundation, Cancer Council, and then some local council areas. We launched the discussion paper, and then we had a public seminar. We put together a pre-budget submission, and then finally did a whole bunch of meetings with different government departments and ministers, just to try and get some engagement on this and try and pitch to them our idea. So this is you can go to our website and read the discussion paper, and our partners were involved in that. And I'm just going to quickly go through what our VML agency had sort of created as the campaign, or as the advertise, the thinking behind the artwork. So there's currently a disconnect in Australia. Cars pump out toxic fumes into the air every day, but people on some level are aware of this, but don't necessarily realize the damage that it's doing to our health, particularly the link between this and childhood illness, such as asthma, which is more prevalent than ever. Australian parents and caregivers who want the best for their kids go to great lengths to do the right thing and keep them safe, and they would never knowingly put them in danger. But when it comes to everyday transport like cars, the convenience and familiarity can cloud the sense of risk and caution. If they thought through exposing their kids to toxic fumes, they never would. So there's a lot to worry about these days, and comfort and convenient tends to win in the fight against busy. Parents are doing their best. They carry an intense mental load during the week and tend to be focused on putting one foot in front of the other. Leaving the car idling isn't on the top of their bad behaviours hit list. So what we needed to do was get Australian consumers, namely parents of young children, to understand that car idling is contributing to the ill health of children by linking what they already know about nasty car fumes. Car idling is the opposite of fresh air. And so this is the proposed creative that VML came up with. Turn off your engine when parked, asthma pickup zone. So it really needed to be quick and visually compelling. And we've actually since heard back from council that these particular colours in some council areas are not allowed because of its similarity to like emergency signage. So already we know that there's some adjusting to do, but you can kind of see where we ended up with in terms of taking like all of the research evidence and then turning it into a really simple, really effective education campaign for parents in particular. As I said, we met with all the different relevant departments, and that's kind of ongoing. We've only been at this for 12 months at this point, so this is an ongoing discussion that we're continuing to have. It was a little bit delayed because of the election campaign earlier this year, but we're retaking up those conversations. And then finally, where we're at the moment is just to say we have the evidence, we have a solution, which is, doing an anti-idling campaign at schools, and that can look like both the grassroots local action campaign, so starting it off like what they did in Sydney with the DEA colleagues of mine. But we're also saying, this could be run as a national awareness campaign. It would require some money, but it would mean that you could kind of run like similar to the tobacco campaigns, things like that. You could run some sort of advertising campaign to raise awareness and to start off that behaviour change and policy change that we need to do. And so, yeah, that's kind of where we're at, and it's an ongoing place. We're welcoming anyone who would like to partner or fund it and help us kind of continue this journey of implementing the Idle Off campaign. Thank you.
Thank you so much, Hannah, for showcasing the great work you and your team are doing on advocacy and policy approaches to raise community awareness about anti-idling. So now I'll open the floor for any questions that the attendees may have. I know, Justin, you've already answered some of the questions, but maybe it'll be good to just revisit some of them. So Dorothy had a question about reducing the risk of passing disastrous climate tipping points such as prescribed burns, which has been shown to increase long-term risk of bushfires. What do you think can be done to set the record straight and implement better policies to limit prescribed burning to where it won't increase long-term bushfire risks?
Yeah, that was that was a great question, Dorothy. And look, I think Hannah just gave a great way of that mechanism for evidence to inform and to then shape policy. But I think we need first the general thing is get the peer-reviewed publications out. If we are all in agreement that yes, the peer-reviewed publications are there, and then it's just inaction by the politicians of the day, then that's maybe just some lobbying. I've certainly not worked in a research area before last year where we've had so much intense interest from all these federal agencies. So CSIRO is federal, but Bureau of Meteorology, ABS, Australian Climate Service, Geoscience Australia, it's all federal agencies, all laser focused in on this climate change question. So there is certainly a lot of political awareness, but yeah, I think that the other part of your question about the wood heater use, yes, that's whether that becomes eventually mandated to be banned, that remains to be seen. The prescribed burns, maybe from some fire-related material, I thought it was that the prescribed burns are generally done in the cooler months or wetter seasons. I know this year there's been a lot of wet in many parts of Australia that's impacted the ability for fire crews to do these prescribed burns. But whether that's different to your experience, happy to if you jump in and correct me about, these prescribed burns contributing themselves to more risk of bushfire. But certainly there's no doubt that the prescribed burns and backburning can, they do create exposure risks particularly for vulnerable people. But yeah, so that's my view on that question.
Thank you so much, Justin. So Hannah, there's a question from Arabella. Do you agree that clean air zones around schools must have anti-idling laws in parallel with wood heater prohibitions?
Yeah, look, I don't think my expertise is not in the impact of wood heaters on respiratory health. I know it's part of the puzzle, and I was recently at a DEA conference at Parliament House, and someone spoke about this as being sort of quite a important policy area to combat as well. I know in the ACT they've banned wood heaters from being built in new builds. So I think they're certainly complementary. I think with policy change, you've got to keep the messages simple, and I think the more that we add in all of the sort of different competing elements, it can just mean that it's easier for people to disagree with you, and it's easier for people to say it's too hard. So I think at this stage, we're really focused on just a really simple message of what the impact of car idling has. We know that we're not saying don't drive to school, although of course we're hoping that it encourages people to get more active and use active transport methods so that there's those co-benefits of bike riding and walking and things like that. But what we're really trying to get people to understand is that initial link between air pollution and health, and do that in that really simple way where the evidence is completely established. There's no fighting in the science anymore about the causative impact of transport-related emissions to respiratory health. And because of that, it's ready to be attacked as a policy issue. So yes, I mean, I totally agree wood heaters have an impact. And I think, more than anything, there's kind of an umbrella that we need to talk about clean air just in general in terms of the impact on kids' health. But we certainly wanted to keep the messages simple and to try and attack one thing so that it was easy for people to understand and not get too overwhelmed with when you give people too much information about multiple things at one time, it's just very easy for them to shut off.
Yeah. Thanks, Hannah. I really like the asthma pickup zone sign. It's really simple and I like the colors as well. Is that something that you plan to implement at all schools, or was it something that you tried at a few schools first to see if it works?
Yeah, so what we really would like to do, it's an interesting journey. I guess what we're realizing is like, how do you scale this up? And it's harder than you would think because of the multiple jurisdictions and the different people organizing different parts of. So we would really like to pilot those messages with certain schools in Australia to make sure that those campaign messages work. But then also, I suppose, um, there's different people in this sector who are also very interested in taking up that campaign, and however they take it up is kind of up to, yeah. So I think what we're really hoping to do is design some sort of accessible website for people to understand all the information in a really accessible way, and then they can tailor the campaign to where they are, so that it doesn't have to be just the same one campaign for every school, because obviously you've got different populations and different community groups that require different sorts of messages, and so that's sort of where we're at the moment. The government is certainly keen to hear about this as as a solution, but they also need to know, they need the pilot data to show that it works, that it actually has an impact. We've got some of that data coming out of the Breathe Melbourne study, and that was I mean, it was a qualitative study, and it was only at 2 schools, but so we've got the beginnings of that for sure.
Yeah.
But it's a moving beast. So I know that, we've got some friends at DEA and even Parents for Climate now and CAHA who are all really keen to keep pushing this campaign forward. So it might change along the way, just depending on, how that goes.
Yeah. And it sounds great that you're also like co-designing it with the children themselves and the parents, so that would really help with the messages that you're trying to tell people. So
Mm.
yeah.
Yeah, I think I mean, Justin touched on the impact of eco-anxiety. What we're looking at as a unit, we've got some colleagues that look at the impact of like eco-anxiety on children's mental health, for example. And one of the positive impacts of the Breathe Melbourne pilot was that the children themselves reported that they were feeling less anxious about climate change because of the impact of them sort of contributing to some sort of solution. And I think having that feeling empowered to do something to change climate change has a really positive impact on eco-anxiety and those other negative effects of feeling hopeless about what's going to happen. So it's really important, as you say, to have those co-design elements, which is why we've got the beginnings of an art campaign artwork, but I'm very open to it changing depending on who the community is that we're working with. Those essential messages are still there, but it might look different depending on which community we land in.
Yeah. Thanks, Hannah. I guess like for Justin, you showed us the like the R Shiny app. Is that application like publicly available?
Not yet. So we have to test it in the cybersecurity considerations and all those things. But yeah, we'll also be talking to Bureau of Meteorology about potentially incorporating that. There's a lot of other areas, but this thermal comfort is something that we think, well, how do we take this to put it in the hands of someone like the air pollen warning systems? But that sort of idea of can we is even there an appetite for that in terms of health system impacts? But yeah, it's planned for external facing, but at the moment it's not.
Yeah. Thanks, Justin. So it's already 1 p.m. and I'll conclude today's webinar. Before I do, I just like to extend my sincere appreciation to both Justin and Hannah for sharing their time and insights on these topics. We hope our attendees have found the discussion valuable and informative. There are a few questions that we did not manage to get through, but we'll pass them on to the speakers and be in touch with you soon. If you have any further questions or would like additional resources, please don't hesitate to reach out to the Centre for Safe Air. We look forward to seeing you at our next webinar. Thank you and have a great day, everyone.